Folks, if you're just listening in, we have Dr. Grundy here with us, our podiatrist. Does a great job. I want to get into this because we do have one other guest we want to get in here today real quick. But she's working on some veterans programs. That's another reason. She's treated a few of our veterans. We've got them over there. She's been very good to one of our Navy guys that's, fighting homelessness and stuff like that. And she's been very, very kind. She set him up with some clothes, and he has some foot stuff that we won't talk about, but she actually got him some bags and stuff. Her ladies there were doing a great job, believe me. But they are able to set him up with some clothes. He's able to take a shower and stuff now, which he wasn't able to do before. So it means a lot. That's how much she cares. But she's got some programs coming up that we want to get out there. That way we can get some more sponsors for this project and then do a lot of good for our veterans out of it.
As a veteran myself, I'd like to ask one question. You know, when we were in Vietnam, in the boonies, we actually wore our socks, and we didn't. Maybe once in a while we changed them, but the fact of the matter is, it would cause us to have a really bad situation on our feet, and so you've treated people with that.
Yeah.
Good.
Like trench foot? I mean, you just are in a constantly
but that's
moisture-rich environment.
Yeah. But actually, that's about what it was. I mean, fortunately, we got back into the rear where we could take a shower and stuff more than they did in World War I and World War II. You know, World War II is terrible too. But anyways, I'm glad you could do that too and help people in that way.
Well, yeah, that's exactly why I'm saying we got a lot of things from the Vietnam, Korea. I mean, a lot of them are starting to pass. That's another one. I mean, it was so much, the feet weren't thought about. I mean, they did foot inspections, don't get me wrong, but when you're out in a combat zone and stuff like that, I mean, there'd be days that, when I was in Kuwait in the desert, it's, you're not going to go to the store and pick up another pair of socks, obviously.
Right.
So, but you'll get you got so many pairs, and you know what, all the salt and junk, it's not good for your feet. That's why your feet sweat and do all that stuff, to get rid of that garbage. So, but we're going to get some more questions out there, but I want to hit this veterans thing here because let's get some
in
help
light
and
of what
get it set up.
you were saying, we actually just recently had a patient that had foot problems on both feet, and we didn't realize that his home life situation was not good, and that was affecting his healing. So once this was brought to my attention in my office, staff was very concerned about this gentleman. We did put together some items and gathered some necessary toiletry items for this gentleman and gave that to him. He was very, very appreciative. But my office manager and I were talking, and it raised awareness from my perspective that, patients don't come in and necessarily disclose their situations, and particularly our veterans are sitting in an environment where it's not conducive to their health. And I was very concerned about this because, this is one experience, and I'm sure I've treated other veterans that have had similar situations that we have not discovered. So we're putting together a program where we can offer assistance to our veterans, and we're going to provide them with foot care and supplies that they need. We haven't quite worked out all the details, and we welcome any sponsorship or donations for the program. We also have an orthotist that is in our building that does shoes and insoles. A lot of this is covered under the Medicare program. It's just a matter of recognizing what the need is through our office and getting them to the proper place.
Right. I mean, you worked on a friend of ours. He lost 2 toes, 1 on each foot, so they had to get him special orthotic shoes. And then, like you said, and sorry, Mick, but yeah, he was stubborn. Just thinking he was going to heal. He couldn't bandage his foot, so he put the bandage on the ground and then roll his foot into it. Oh, come on, people. You know what? I don't care who you are, but your floors aren't that clean at home
Well,
to get it that clean. And he ended up, from stubbornness, he almost lost his whole foot. The doc was able to
and
work on
unfortunately,
that.
he could lose his life from this.
Yeah, just the gangrene getting in there,
Or
if
infection.
it does. But he ended up losing a toe and a piece of the side of his foot. So you'd have to watch that because, like the doc said, it will start as a little fester and work its way in.
Or
But-
you don't recognize what you're looking at. You may think it's a blister or it's just a bruise, but in reality, it's a circulation problem.
Right, and it could be like an ulcer, like you said, and then get infected. Now, if you have bunions and corns, I don't know the difference. So that was my big question
Okay.
to ask you. But if you don't get those treated, can that lead into something more detrimental to you?
Well, and bunions are actually most of the time a hereditary problem. So your mother, grandmother,
I
aunt
had them.
has bunions, and so
I had
it's
a bilateral bunionectomy when I was in college.
Yeah.
It was like, I'm getting rid of these things.
and that's hereditary. You
Yeah.
inherited that, and
I
what's
did.
interesting
mama.
is a lot of times
No,
we can
please.
recognize that early and put patients in corrective orthotics that correct the biomechanical problem to prevent it from getting to the point where you need surgery. We have great products now. I started my own practice, South Shore Foot and Ankle, 7 years ago to offer an array of treatment options to patients. We are full service, so we even have shoes that have orthotics built into them that are good looking. So we
They have a whole book. Yeah.
I like the dance shoes.
Danskos, yeah.
The Danskos, that's on my bucket list.
Yeah.
Yeah,
so
but no, I had it done. It was truly promoted.
yeah, and we recognize it's a matter of knowing what your problem is, identifying the proper diagnosis, and then treating it. And that's
Okay,
what we
what's
specialize.
a corn?
So a corn is a skin reaction to pressure. So depending on what part you have it on, most people will get them on their toes, either on the top or in between the toes or on the bottom. And that's a problem. Either the toe is not sitting in the correct position, and so it's rubbing on the neighbor toe or the shoe, or you're getting pressure on the bottom from basically the toe is sitting a little lower in comparison to the other toes.
So that's like surgery, corrective surgery, or
Not
can you put them in
necessarily.
orthotics again?
Yeah, a lot of times it's recognizing what the underlying diagnosis is and treating that. Sometimes it is a surgical correction, but a lot of times we can treat people conservatively.
There you go. folks.
Sometimes it's just
Preventative
your shoe.
is the best. I always looked at it sometimes, I'm hard-headed like that, and I'm learning, believe me. If it's not broke, don't fix it, Don't touch it and let it go, But I've learned, believe me, these last 7 years, I've learned.
Yeah.
And this lady's taught me a lot. You got to do this, you got to do that. Now, I have Leber's disease, which makes my feet get really, really hot.
Well, and people don't know what that is.
Oh, it's a genetic defect of the nervous system and the optic nerve, but it makes my nervous system kicked in and my hands get really hot and my feet get really hot. And and as you get older, through the circulation and stuff, you have to keep your feet hydrated. Now, that's a big deal, isn't it?
It is a
Because if
huge
not,
deal.
they start cracking and then you end up with sores and it could lead to a mess. So
Your
what
skin-
do you suggest for that? I mean,
Each person is different. There's certain types of skin moisturizers that I recommend, but CeraVe, Lubriderm, and Aveeno all are great over-the-counter products.
so everyone used to say not olive oil,
Vaseline,
and vitamin E.
yeah, vitamin E.
Is that good? Straight olive oil, or what is that? Aloe vera oil. There we go. I'm going to say olive oil. I'm not cooking. We're working on the feet. Well, we're cooking on the feet sometimes.
I heard Vicks was really good too.
No. Vicks for fungus? Doesn't work. Sorry, people.
All right. We haven't
Makes your
got
toes smell.
Yeah, no kidding. We haven't got your website, your Facebook. I didn't know you had Facebook till Tuesday.
Sure. You
And
can find us.
your phone number. Let's get that stuff out there.
Sure.
This question I have is a friend of mine, a very dear friend of mine who's a minister. He actually had diabetes. Okay, so what happened to him was his leg started to lose feeling in it, and probably he should have came to you at that point. and what happened is that he lost his leg due to that problem, and he had the diabetes. That's very important that people know not to mess around with diabetes.
Yeah, we like to see our diabetic patients at least once a year, depending on how much pathology or problems they present with. Sometimes we see them more frequently. We do diabetic nail care, and we see them every 3 months, maybe as soon as 2 months, depending on what their needs are as well. It's funny you say that. When I first started practicing, I treated a rabbi of one of the other doctors in my practice, and he had a wound on his pinky toe that wouldn't heal. And I looked at it, and the toe had deformity to it, and I said, we can operate and straighten it. It's rubbing on your shoe. And I did his preoperative lab work, and sure enough, he was diabetic. So technically, I diagnosed him with diabetes, got his sugar under control, his wound healed, he was fine, he didn't even need surgery.
Wow, that's great.
So we probably saved his life.
Yeah.
And don't forget, Medicare folks, you can go in there once every 3 months for a foot inspection and to get your nails trimmed.
Yeah.
So, I mean,
We're here for
take
you.
advantage of that.
Yeah, we're here for you.
Hey, it's a free foot inspection. I mean, every 3 months you get your feet checked out, you know.
I wanted to say as well, one of the other comments that we were talking about earlier, where you had an issue that wasn't basically diagnosed and treated properly, and it became a problem for you over several months. And so patients might go to urgent care thinking that that's their best solution for their foot condition. They should actually just come directly, call our office, South Shore Foot and Ankle. We'll take care of you. We'll solve your problem the first time. And urgent care, primary care doctors, they're great for a lot of things, but they're not specialists in foot or ankle. So they're going to give you just partial care, and then...
And they're going to send you to the podiatrist
yeah, you're going to end up here anyway.
So you're going to end up in the right place. So.
And we'll get you taken care of the first time around. So I'll share our information. Our office is located at 951 Transport Drive, which is in the Ivy Tech Business Park. We are on the east side. We have a nice office there with a handicapped accessible bathroom, multiple treatment rooms available, x-rays on site. We do carry multiple products, including crutches, walking boots, ASO braces, over-the-counter orthotics to get you taken care of the day you come in. We do have a website. It is www.southshorefootand.ankle.com. You can also find us on Facebook under South Shore Foot and Ankle.
And your phone number?
219-464-4100.
Right. Call in anytime. Talk to Stacy. She'll take care of you. All the girls are great there.
You
You'll
know
see
everyone's
Tiffany
name.
and Amber. Oh, you got them all.
Yep.
Savannah does your paperwork if you got any questions, and Judy's the manager. So
Correct.
Like I said, I've been with you for a while. I mean, I've actually...
We're like family.
We moved the business and everything. I don't know how much of it I own, but I know I own a piece of it somewhere in there.
You have your own room.
Yeah, probably the toilet paper holder, but in my book, me and Mike Bottom. But anyways, she'll do you a great job. Now, that Transport Avenue is over there on...
Transport Drive.
Or Transport Drive, thank you. Is on the north side of the airport. If any of you are aviation experts, it's on the end of 27 runway. And
I didn't know that.
It's right there. And now, if you're really smart, when the policemen are out there and they're doing some devil dog stuff, park in her parking lot on Sunday. Go out there and watch the guys do their stuff, because you can go right up to the fence. So, but she does have a great facility, and she's adapted it when she moved to make it fit the needs of her patients. She had another spot that she was running, and then she grew up and got bigger and everything, and then she's got these rooms now built for her exact patients, what they need and stuff like that. So, Doc.
And I have an associate, Dr. Meyer, so we can treat patients every day of the week. So if you have a problem, call us.
Right. She does our surgery and stuff like that, so on Tuesdays and Thursdays.
And we're board certified. Thank you for bringing that up.
Yes, well, I was going to ask you
We've achieved
about
the highest level of certification you can possibly achieve.
And she is well known, or knows well the new techniques and treatments for, because you do some, take some cadaver stuff out there and, able to fix spots. So, Doctor, I want to thank you for coming. Again, that phone number is 464-4100. Just talk to Stacy. She'll set you up with an appointment. The doc's really easy to get along with, and she'll point it out, and she'll be straight up with you too. That's the other good thing about her. She may joke around and stuff, but she's going to be straight with you. Tell you what you got to do. If you want to listen, that's your problem. I mean, you know what? But here it is, and she'll tell you straight up. So, with that, Doc, thank you very much for coming in. We'll get you one more around here.
Thank you very much